Your period can change on Ozempic or Mounjaro, and that does not always mean something is wrong. In many women, the bigger shift is weight loss, lower insulin, or ovulation returning. That can mean the body is releasing an egg again. That can reflect fertility change, pregnancy risk, or a normal shift as the body adjusts. But not every cycle change points to returning ovulation. A missed or late period on these drugs can mean several different things. It can reflect rapid weight loss. It can reflect stress, nausea, and lower calorie intake. It can also reflect changing fertility, which means pregnancy risk may not be what it was before. That is why this topic gets misunderstood. Many women assume any cycle change must be a side effect in the simplest sense. Sometimes it reflects changing weight, changing hormones, or changing fertility. Sometimes it points to birth control failure, especially in women using birth control pills. Sometimes it is a warning sign that deserves real attention. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Start with the basic mechanism. Ozempic, semaglutide and Mounjaro, tirzepatide, change appetite, body weight, insulin levels, and how fast the stomach empties. Those shifts can change when ovulation happens and when the period starts, so the cycle may change even when the drug is not directly targeting the uterus or ovaries. Insulin resistance is one important piece. That means the body needs more insulin than usual to get the same result. High insulin can push ovulation off schedule in some women. When insulin resistance improves, ovulation can become more regular, and the period can suddenly look very different. Weight loss is another major piece. Body fat does not only store energy, it also affects estrogen patterns. When weight drops, hormone patterns can shift, especially if the drop is fast. 1 or 2 strange cycles can happen while the body is moving toward a new balance. Food intake matters too. Some women on these drugs eat far less than they realize. Nausea, early fullness, and food aversion can all shrink intake. That can create body stress, and body stress can disrupt the cycle, so the drug may be part of the story without being the whole story. Some women become more regular. Others become less predictable for a while. Women with insulin resistance may ovulate more regularly as weight and insulin levels improve. The same change can happen in women with polycystic ovary syndrome, a hormone condition that often causes irregular periods. Women losing weight fast, eating too little, or getting dehydrated may see the opposite pattern first. A changed period is not always bad. In some cases, it means fertility is coming back after being low or unpredictable for a long time. That sounds positive until the person involved was not planning a pregnancy and thought her old cycle pattern still protected her. Mounjaro needs special attention here. Tirzepatide can make birth control pills less reliable because it can change how much of the pill gets into the body. Women using birth control pills should consider a non-pill method. They can also add condoms for 4 weeks after starting and after each dose increase. Ozempic does not carry that same direct warning about birth control pills. Semaglutide also slows stomach emptying. But the official label says it did not change how much of the pill got into the body enough to matter in trials. That difference matters because a late period on Mounjaro while using the pill pushes pregnancy higher on the list. Some women read a strange period as proof that the drug is harming them. But the more important story can be very different. Weight is falling, insulin resistance is improving, and ovulation is returning. In this setting, pregnancy risk may be higher than expected. Some women need more caution than others. Women with a history of very irregular periods need more caution because a new pattern can hide returning fertility. Women using birth control pills on Mounjaro need more caution because that backup warning applies directly to them. Rapid weight loss, frequent vomiting, or very low calorie intake also need more caution. In those women, body stress can push the cycle around even further. Women who recently stopped birth control can misread these changes. Their cycle may already be resetting before the drug has much effect. Women nearing menopause can also misread the cause because their cycle may already have been changing before they started the drug. One symptom does not always tell you whether the main cause is the medication, weight loss, or pregnancy. Some patterns need medical attention right away. Heavy bleeding can matter. Bleeding that lasts much longer than usual can matter too. Severe pelvic pain, fainting, and repeated vomiting with dehydration can matter too. A missed period with any real pregnancy possibility should not be brushed off as just the medication working. A cycle problem that keeps repeating is a stronger warning sign than one unusual cycle. One odd cycle can happen during adjustment. Several months without a period deserve evaluation. Very frequent bleeding deserves evaluation too. Cycles that keep getting more chaotic deserve evaluation because a temporary shift is one thing, but a widening pattern is another. Do not panic at the first change. Figure out whether the change is more likely to reflect adjustment, stress, birth control failure, or pregnancy. Ask when it started, whether it followed a dose increase, whether weight loss became rapid, and whether food intake dropped sharply. Also, ask whether you are using birth control pills, especially with Mounjaro, because that detail changes the meaning of the same symptom. Track the pattern instead of relying on memory. Write down start dates, flow, pain, spotting, nausea, dose changes, and whether you might be pregnant. Also write down whether your calories dropped sharply or whether vomiting and dehydration showed up. A clean timeline makes the next step easier. If pregnancy would be a serious problem for you, do not treat this casually. Follow the Mounjaro birth control warning exactly. If your period is late and pregnancy is possible, test early instead of waiting for certainty. If you are trying to conceive, bring that up before the cycle becomes confusing. The Ozempic label advises stopping at least 2 months before a planned pregnancy. Do not stop the drug automatically after one unusual cycle unless your own clinician tells you to. A single change can be temporary. If the pattern keeps changing, review what changed at the same time. Dose, calories, hydration, contraception, nausea, and speed of weight loss all help explain the picture better than one symptom by itself. Prevention is mostly about reducing chaos. Extreme undereating, dehydration, and raising the dose too fast make the picture harder to read. Steadier nutrition helps, better hydration helps, slower dose movement, when your own clinician agrees, can also make the cycle easier to interpret because fewer variables change at once. Prevention works better when you know in advance that these drugs can change ovulation timing and birth control reliability. One cycle change may come from more than one cause. Do not ask only whether the drug caused a side effect. Ask what changed in weight, hormones, and birth control after the drug started. If your period changes on Ozempic or Mounjaro, do not jump straight to one explanation. The change may reflect temporary adjustment, body stress, returning ovulation, or pregnancy risk. A strange cycle is not always a danger signal, but it can be a fertility signal or a pregnancy signal, and missing that difference is the real mistake. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor